for us. Thank you. So welcome everyone. My name is Jeannie Alter. I am the Executive Director of the American School Health Association, and I'm so pleased to have you here today. And I'm really excited to, along with our guest, to tell you a little bit more about an effort that we've been involved with over the past year or so. And it's really important work, and we're really excited and proud of the work we've done so far. But first, I'd like to tell you a little bit about ASHA, as we call it. So we are a multidisciplinary professional association, and we hope to transform all schools into places where students learn and thrive. And we do that by working together within the school, within the WISC components, or the whole school, whole community, whole child model. So we believe that it's very important, especially in times like now, where we're all under a tremendous amount of stress and really kind of experiencing very new things to us, that we all work together and we work in a coordinated fashion. So ASHA has been doing this work for nearly 100 years, and it's never been more important than it is now. Just a little bit about our association. We hope that you will take a look at our website, which is ashaweb.org, and consider joining. We have several member benefits, including our peer-reviewed Journal of School Health. It is available in print and online to all members. We also offer continuing education. So for example, that could be for a webinar like this today. It could be for self-studies, webinars, or our annual conference. We also offer a variety of discounts. And we also connect you with a wonderful and very supportive group of experts in the field, allow for some wonderful networking and information sharing. And we allow you to interact with each other through our annual conference. This year we will be taking our conference virtual, as many are, but we'll see you again in Albuquerque in 2021. We also invite you to sign up for our bi-weekly newsletter. It has a lot of really great information. You can stay on top of what we are up to and the new things in the field. So as I mentioned, I wanted to share with you today a little bit about a project that we've been involved in, and it's called Shine Light on Depression. Oops, excuse me. Oh my gosh, I got click happy. I apologize. And today we're going to talk a little bit about the community conversation aspect of the project, but we'll go over the other aspects as well, just very quickly. So what we plan to cover today is to talk a little bit about the need that we recognized as we and the partners all work together on this project. The resources, I'll share with you who our collaborating organizations are. We've got a great group of people together and organizations that are doing really great work. We'll talk more about the family school community conversation, and then we'll have some time for you all to ask some questions and let us know what's going on with you and how we can help. So as you all know, our nation's youth are struggling with increased rates of depression, thoughts of suicide, and self-harm. And I think this is even more critical as we are dealing with this global pandemic as well. So we know that anxiety and depression are a very prevalent problem among teens. We are seeing suicide rates rising, and we're seeing that suicide is now the second leading cause of death among youth. This is why we felt it was really important to act. And we are also facing a global pandemic, and we know that this experience is going to change our thoughts and feelings and behaviors. And we're seeing increased feelings of anxiety, fear or worry, and loneliness during this difficult time, not only among our teens, but ourselves as well. So we need to recognize that these are very extraordinary times and that they come with a whole host of issues that we need to be attentive to. So Shine Light on Depression is a web-based toolkit for school and communities that has free and ready-to-use resources to help raise awareness of depression and prevent suicide among youth. So there really are kind of two goals there, and that's to raise awareness and prevent suicide. And you'll see that reflected in the materials as we take a look at those. So you can visit shinelightondepression.org. That's where you can find this web-based toolkit. And we'll take a moment to take a look at what is available there. So let me I'll drive us to the website here. So this is the website, Shine Light on Depression. I want to point out a couple of things at this juncture.
Okay.
And one is,
Jeannie,
yeah, of course.
I'm going to interrupt. I know I cannot see the website.
Oh, I'm so sorry. Thank you so much.
Yeah, you're welcome.
I gotta make an adjustment there. Appreciate it. Okay. That's better. Now can you see it?
I am still unable to see it.
Oh, boo. 1 second. Well, that looks like it's on the wrong page.
Someone else said they saw it though, so maybe it was just me. Oh, there we go.
There we go. Thank you. I appreciate you letting me know. So I just wanted to share with you a couple of things. So here's our website, Shine Light on Depression. You'll notice some COVID-19 programs and resources up top. As like I said, we're in very extraordinary circumstances. And then you'll notice 3 lockers here. And the first one is classroom programs that can be utilized in the classroom when we return. Also family workshops, which is what we're here to talk about today, and student clubs. So there are a variety of different work materials and access points to addressing this issue. So for example, if we look at the family workshops, we have one, remember I talked about those 2 goals. We have a workshop that talks about mental health awareness in the community, right? Just raising awareness of the importance of good mental health among our teens. And the second one is helping our teens with their mental health. And that gets at our second goal, and that's to reduce suicide among teens. So just to give you an idea of what we have available, let's look at the mental health awareness. You'll find within this section a facilitator's guide, sample invitations to invite community members and parents to a community conversation around mental health, resource lists, and a variety of handouts. So you'll have that for both workshops. And it's a really nice, nicely laid out. And here I'll show you the second one as well. We have, again, a facilitator's guide, sample invitations, and some really great handouts to help you engage in a community conversation. So now I'm going to go back here. Uh-oh, if I go, oh, I did it. I went all the way back to the beginning. That's not what I meant to do. Oh, goodness sake. All right, just close your eyes. Just kidding. All right. So this wonderful group that helped put this together includes the American School Health Association, which we're proud to be a part of this group, Anthem Inc., Erica's Lighthouse, JetBlue Airways, and National PTA. And National PTA worked really hard to create the community conversation pieces to help engage parents in these conversations. So we're really excited to work with them, and we have a representative on the call today in case we have some questions for them. So we have a wonderful guest here today to talk to us a little bit more about mental health among teens. We have Dr. Jessica Chaudhary, and she's a board certified psychiatrist who completed her medical training at the University of Washington School of Medicine, her residency in psychiatry at Yale University, and a fellowship in psychosomatic medicine at Harvard University. She specializes in psychiatric disorders and has treated patients with anxiety, depression, obsessive compulsive disorders, substance use disorders, and bipolar disorders, among other psychiatric conditions. And she is a medical director with Anthem. So I'll turn it over to you, Jessica. I'll drive your slides. You just let me know when you're ready to move to the next. Welcome.
Okay, can everyone hear me okay?
Sound good.
Okay, perfect. Well, thank you, Jeannie, for that introduction, and thank you to everyone for joining today for what I think is a very important topic. So let's talk about it. We'll move on to the next slide, addressing why talk about mental health. So in 1948, the World Health Organization stated that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So mental health and physical health are really inextricably linked. One affects the other, and both are critical to the whole well-being of a person. And as you can see here, I mean, mental health, I think now is getting more and more recognized in how important it really is to our overall health and well-being. Good physical, mental, and emotional health contribute to productivity at school, work, home, and in relationships. And loss of any part of that can really incur significant costs, not only financially to the workforce and to schools, but also personally. So when we're not feeling well physically, it affects daily routines and other aspects of life, and the very same principle applies to emotional well-being and mental health. Okay, so moving on to the next slide. Why is it important to talk about this? I think it's really particularly important for young people, and especially now. So young people face a lot of pressures socially at school and in other aspects of life that contribute to stress and worry and depression and a lot of anxiety, particularly around periods of transition in their school, or if they're moving on to college or they're getting jobs. Those are times that are especially prone to worry for young people. Teen mental health is of increasing concern amongst parents, doctors, policymakers, and even young people themselves. And it's really been alarming, the rising rate of mental health problems that are now occurring in young people, especially between the ages of 12 and 26. At Anthem, I've actually been quite involved personally in starting in designing and putting forth initiatives to help provide outreach for those people that are at high risk, and really offering support and case management and resources to them or their parents or those that might be concerned. And we're hoping to get some of these programs out and in the works very soon, because it's been so alarming how much this issue is affecting young people. So in particular, talking about this issue helps the brain to process a situation, and in turn that releases stress chemicals in your body. You want to think really broadly about who you can rely on: friends, family members, faith leaders, teachers, coaches, and other mental health professionals. These are people who can help guide, problem solve, and encourage people, young people in particular, through tough times. And research is showing, as I've mentioned, that there's increasing rates of depression, anxiety, PTSD, adjustment disorders, and most concerning, suicidal behaviors amongst adolescents and young adults. So on the next slide, mental health awareness in our community. We're going to talk about symptoms and risk factors of teen depression. Caitlin, I'm wondering if you could go ahead and put up that poll statement that we have now for the group. And if you can just take a look at this, and if you would like to go ahead and submit what you think. The question or the statement is, recent world events fuel worry or anxiety, especially about a teen or young adult. We'll take, a half a minute here to see how the responses shake out. So, as we can really start to gather from the poll, the numbers speak for themselves. There are a lot of people, 70% almost, that really agree with this. And that goes to the point that what's going on in today's world, especially with the pandemic and the uncertainty that's been created with school and with other aspects of a young person's life, it really has been fueling worry and anxiety, and that's all the more reason to really talk about what's going on and how people are feeling. Okay, so let's go on to the next slide. So I want to really take a minute here and talk about the signs and symptoms of depression in anyone really, but also particularly in young people. And one of the key things here is to really be on the lookout for changes in behavior, things that are unusual for that person. So you can see feelings of sadness, which can include crying spells for no clear reason, frustration or feelings of anger, even over small or potentially trivial things, feeling hopeless or empty, feeling irritable or annoyed quite a lot, having a loss of interest or pleasure in what normally would have given someone interest or pleasure, having a lot of conflict with family or friends, having low self-esteem, worthlessness, or feelings of guilt, being fixated on the negative, and having extreme sensitivity to rejection or failure, trouble with thinking or concentrating, and just this pervasive sense of negativity. And of course, then, one of the most concerning things is frequent thoughts of death, dying, or suicide, and talking about these, making statements like, I can't go on, it's really not worth it anymore, what's the point of all of this? Those kinds of statements can be very concerning if you do hear those in a teen or a young person. Another really concerning sign of all of this is kind of an abandonment of the future. So not having anything to keep that person going, things to look forward to. Even in the midst of a pandemic, one of the things that's really important is how we think about things and what our attitude is. So even in the midst of negativity, if you think about the positive aspects of all of this, that you will see your family and friends one day, you will go back to school one day, you will be able to have the social outings and activities that maybe you can't do right now. Those kinds of statements and that kind of positive thinking help to combat the depression. And if you're really seeing a lack of that or a lack of forward thinking, that could be a concern. Next slide. You can also really notice some changes in behavior. And I want to point out one thing. The person, him or herself, they might actually not notice the change as much as someone around them might. So a parent, a friend, a colleague, they might say, hey, things seem a little bit off with you. And the person themselves, they may not have picked up on that. So it's important to really pay close attention to people that you care about or you're worried about. So there are behavioral changes, such as feeling fatigued and having lots of energy, insomnia or sleeping too much. And again, the key with sleep and appetite is it can go either way. The most important thing is that there's a difference. So you're either sleeping too little or too much, or you're eating too little or not enough. Or you're turning to alcohol or drugs, there's agitation or restlessness, a slowed thinking or speaking, frequent complaints of body aches or headaches. So remember, mental and physical health, they go hand in hand. And a lot of the pain that one feels mentally can present in the body. And it can seem very unusual. For example, having a lot of stomach aches or a lot of GI discomfort. People can wonder where that's really coming from, but it could be coming from the brain and from your mental status. So also being socially isolated, having poor school performance or frequent absences from school, which now, of course, a lot of things are virtual, paying less attention to personal hygiene or appearance, having angry outbursts, more disruptive or risky behavior, making suicidal gestures or gestures of self-harm, such as engaging in cutting types of behaviors, or having a suicidal plan or a suicide attempt. So it's really important that I also communicate that mental health providers respect confidentiality for patients of all ages, unless there is an acute threat to the safety of the patient or someone else. So Kaylin, we have our next poll question here. Is there a teen or young adult that you are worried about?
Jessica, I have a couple of questions for you at this juncture, if you'd like to.
Sure, yeah, let's go ahead and take those while we're waiting for the poll results also.
So Lydia asked, what if a child was already having some of those issues due to other conditions such as ADHD or autism?
Yeah, that's a good question. And I think what you want to look out for is there a change? Is there a worsening of behaviors? Is there a pattern of behaviors, or are there a pattern of behaviors that are really different from what that child, what we call baseline would be, how that child would normally behave even with conditions like autism or attention deficit disorder? And knowing that, with those types of conditions, sometimes it's even harder to express what you're really feeling. And your expressions and your feelings can manifest themselves through behavioral changes or behavioral outbursts. So if you're seeing a lot of that, or there's something that just seems a little bit unusual, that is potentially concerning. And then did you say there was another question too, Caitlin?
Just a couple of comments. Kristen said, my worry is the forced isolation for those youth already choosing isolation. Oopsies. And then Perry notes that we're having students in elementary who are asking why we should go on since things will never get better. And it is definitely a growing issue. So I think it's wonderful that we're having this conversation, especially now.
Yeah, and those are some really important questions and statements that are coming up. To address the one about forced isolation, you know, if you're noticing that someone is isolating even more than usual, I mean, there are children and young adults and adults that are more introverted, or they just prefer to be alone, and there's nothing wrong with that. But if you sort of see that a person is a little bit more closed off than usual, then that is a time to provide some outreach, to lend that supporting hand or that supporting ear, and just make sure that you say, I'm here for you. Is there anything you want to talk about? Is there anything that's on your mind? Can, you know, offer them help if you feel that they need it. And as for the other question about the students in elementary who are asking, you know, why should we go on since things will never get better? Well, again, this is about, it really comes down to framing your thinking about all of this and how you really do frame your thinking around it, and how what you say and what you convey can then rub off onto children and to other people. So there's been a lot of research that's shown negative thinking leads to negative outcomes, and positive thinking and using words such as I'm grateful for this, abundance, I have a lot, things will get better, tends to improve a situation. And it's important to point out the silver lining in a situation, or to say that it may seem that things will never get better, but there's a lot of people that are working on changing things so that they will get better. You can also use the concept that I've recently learned about. It's the concept of mental time travel. And it's kind of a fun exercise that you can do with your children or with your families over dinner, where you imagine strapping yourself into a time machine and going fast forward in time when this pandemic is over and there is a vaccine and people are better and things are starting to feel more like normal. This is something that's called counterfactual thinking, but it helps us to understand that things actually could be worse. And so it in turn then helps us appreciate all that we do have, and it helps us envision and imagine a day when things will get better. Every generation has challenges, and we have these challenges right now, but emerging from the difficulties that you see now typically makes us stronger. So it's really important to convey that message of hope and positivity to a young person who has those kinds of concerns. So just looking at the polling question, you know, that's also pretty striking. You have about, 60% of people saying that there is a teen or a young adult that they're worried about. And I think it's really important that you reach out to those people and set aside some time to talk to them and try to understand what might be going on, or help them get connected to somebody who could help, like a mental health professional, or a coach or a teacher, or a religious support person or a spiritual support person, somebody that they could maybe trust. And I see a question that's come in, how can we be more supportive to our Black and Brown students who may be experiencing anxiety with what is going on? And that's a really good question, and it's a tough question, because we obviously live in a somewhat unjust world, unfortunately, and we've seen a lot of racial disparity recently. And that can be very anxiety provoking for students of color in particular. And there are some things that you can do. You can be really blunt with with any child about what their fears are. You can even work through some scenarios with some of these children and act them out and try to get a sense of what's fueling that anxiety and how to combat it. And one of the things that I think you can do with any type of anxiety is to try to channel that anxiety into positive action. For example, with all of the racial violence that we've seen recently, one way to channel that anxiety into action is to participate in peaceful protests so that things can change, so people can take notice, and you can do your part, and you can seek out those that may have some influence over making those real changes. But it really starts with you. It starts with what you do and how you start to lead that effort for change. So channeling some of that into some concrete positive work could be one way to tackle all of the profound concerns about race that are going on now, especially for young people. So I'll go on, and then we can certainly come back to questions. And please feel free to interrupt me if you see some more questions that are popping up as I'm speaking and going over the slides. So on the next slide, we're talking about what's normal and what's not normal. So again, it can be difficult to tell the difference between a normal up and down or what's just part of being a teenager and teenage depression. It starts by talking with your teen or your adolescent child or your young child. You have to try to determine whether he or she seems capable of managing these challenging feelings or if they're just too overwhelmed. And if the signs of depression continue, you have to sort of begin to think about making some concrete changes. If you're acutely concerned about a safety issue, such as suicide, you have to really right away talk to a doctor or a mental health professional who's trained in that area, or call 911 if there's just an acute concern. This is really a profoundly challenging time. It feeds feelings of uncertainty. It's normal to feel some anxiety, disappointment, frustration, and anger. But if these feelings are becoming overpowering or overwhelming or taking over your thinking or affecting your ability to function or your ability to stick to your normal routine, then it really may be necessary to seek some professional help. Okay, so let's talk about some of the warning signs about suicide. It is, in general, a relatively rare event, and it is difficult to accurately predict who will ultimately commit suicide. And it's often an act that's done impulsively. It's done out of a feeling of intense anxiety and not knowing what to do, where to go, or who to turn to in a moment of panic. And that impulsivity is what often leads to this kind of suicidal behavior. But here are some possible warning signs. So talking about dying, any mention of it or disappearing or acting in self-harm behaviors, having a recent loss through death or divorce or separation or a relationship, Loss of relationship for young people can be particularly very difficult. Having a change in personality, as I've mentioned before, or just even being very apathetic or indecisive, and that's again out of character. Having a change in behavior, change in sleep, eating, feeling out of control or acting erratically, or not really having a sense of respect for life in general, yours or someone else's. Having low self-esteem, and again, having that feeling of a lack of hope for the future and believing that things will never get better or change. And having that feeling really persist to the point that you're kind of paralyzed by it. You're unable to do other things or engage in activities in the moment because you just feel like, what's the point? Things are never going to get better. That's the part of it that can be concerning. So let's move on to the next slide. These are some of the questions that you can ask. You can ask, have you thought about suicide? Do you have a plan? What have you thought about? And if they answer yes, then you really ought to seek some immediate help. Now, there's some misconception out there that talking about these things leads to suicidal behavior. That is not true. So research shows that asking these types of questions will not encourage suicidal thoughts. And the fact is that talking about suicide provides the opportunity for communication and direct communication. Fears shared are more likely to diminish. The first step in encouraging a person with thoughts of suicide to actually live comes from talking about what they're feeling. And a simple inquiry about whether or not the person is intending to end their life can begin this conversation. But it should be managed carefully. And again, if there's a serious and acute concern and you're worried about someone's safety in that moment, then professional help should be sought. Okay, let's move on to the next slide, variation by community. So all communities are different. Certain communities might be more likely to see certain types of symptoms, and some risk factors might be more prominent than others in your school community. So in school communities, for example, bullying can be a risk factor for suicide, or having a culture where there is a lack of open communication about mental health can be stigmatizing and really discourage those in need from seeking help. There are also links to certain illnesses such as asthma that could increase the risk of suicide, particularly if there are other mental health concerns underlying. I think it's really important for schools to pay attention to mental health, and there are programs now, such as a program that's called the Ruler program, that's helping to build mental awareness in school communities. And the Ruler program, for example, helps children assess their feelings, put a color on their feelings, and helps them talk about and process what they are feeling, and if they're feeling anger or frustration, or they're feeling a sense of hopelessness, about how to potentially change what they're feeling into more positive emotions. Okay, so now we'll go on to the next couple of slides about helping teens with their mental health and steps you can take. And then on the next slide, what to do if you're worried about your teen. So again, talk to them when they need help. Listen to them. That's even more important. Provide a safe atmosphere so they can open up and talk to you. And this can be easier said than done. But you can make them feel safe, right? You want to provide a nurturing, safe, and supportive environment to them. And allow them to be able to express whatever emotions they are to you in a way that feels empowering and safe and nurturing. I think it's really important that adults and parents keep their own anxiety in check when they're talking to a teenager, because their anxiety rubs off on the children, and it prompts people to want to just sort of fix everything quickly. But instead of reacting and being reactive, it's more important to listen and to formulate a strategic plan about how you can help and get them the help they need over a period of time, because it will take time. You want to affirm and support their need for help. You want to tell them you're proud of them for sharing their feelings and that you appreciate their courage. And if you need help in communicating, you can get help from a third party, from a therapist or a school psychologist. And you want to be genuine, because teens can tell, young people, they can tell when you're being genuine or not, and whether you're being authentic or not. And if you don't know something, say, I don't know, instead of trying to come up with things that sound false or misleading. If you don't know something, you can try to find answers. And on the next slide, we're talking about what if you're still not sure if your child needs help. Reach out to the pediatrician, a mental health professional, a child's teacher, and get another set of eyes to look at the situation. So we'll put up another poll question. Are you comfortable seeking professional help? That's great. We're seeing a really strong response to that, almost 90%. So that should really feel empowering that you can get professional help. And, you know, one of the sort of silver lining, so to speak, of this pandemic might actually be that in some cases, now that there's so much telemedicine and telepsychiatry and teletherapy, that more people might actually be able to access when they weren't maybe necessarily able to do that before. So if you think you need help, get help, because it is likely to benefit you. Okay, that's great. So we'll go on to the next slide. Okay, what can you do? So again, help your team speak openly, support their strategies for good mental health, which includes exercise, nutrition, a good amount of sleep, at least 7 to 9 hours every night, avoiding harmful substances, managing stress in positive ways, and practicing mindfulness. And shine light on depression with your school to create real and hopeful conversations around mental health and in your school community is another resource. So now more than ever is a time we really need to think about strategies for good mental health and for building resilience. There are things to build resilience and increase hope, such as giving back and finding ways to use your strengths and talents to help others, and really just being more grateful for everything that you do have. There are also science-backed strategies to build resilience, which is helping to change the narrative, as I've talked about earlier, while helping to keep your values at the center of that narrative. And this involves retooling your thinking to focus on the positive and facing your fears. And when you face your fears directly or head on, you might really feel lousy or weak, but that's okay because it'll help you process your fears and learn to overcome them. And it's important really to practice some self-compassion, take care of yourself and meditate and cultivate a culture of acceptance and forgiveness. All of these strategies help to reframe our thinking, and changing our thinking towards the positive builds psychological immunity, which in turn highlights the positive aspects of a situation. And it's really important that we, as adults or as parents, learn to help young people build that psychological immunity to face the challenges and to overcome the challenges and look forward to a brighter future ahead. So on the next slide, it says, you know, it's been said that it takes a village to raise a child. You want to let your school community be part of that village and embrace all the people that can help raise a child so that you can protect young lives, reduce stigma, and create a climate for good mental health. And with that, I'm going to turn it over to Jeannie to discuss some resources.
Thank you, Jessica. That was really great information. And I want to take just a moment to, I want to share with you where you can find immediate help on our Shine Light on Depression website. We know that there might be situations that will come up and you'll need assistance right away. So let me pop over there one moment. No, that's it. All right. So back to the website. If you go to the home page, you will see a couple of things. So there are lockers. So here is a link to our community connector, and that involves a space just to get help immediately. Very quick resources to things like the National Suicide Prevention Lifeline in English and Spanish for deaf and hard of hearing, crisis text lines, all the things that you might need as you are maybe in the thick of a crisis. If you feel like, as Jessica pointed out, you feel like there's an immediate need, this is where you should go. I also want to highlight as well that there are mental health and substance use resources here, including the Erica's Lighthouse, the Trevor Project, Substance Abuse and Mental Health Services Administration. So there are a lot of really great resources there if you just want to learn more about the topic and have a really great list of resources to reach out to. And then finally, I just want to let you know that we have additional programs to explore. And that includes mental health first aid. I know somebody mentioned QPR in the chat box, and I appreciate that. Hopeful Minds, What's Up with Opioids. We know that, there are a lot of issues that our students are dealing with. So please take a moment to take a look at those. Let me pop back over here. And I wish that I remembered. Here it is. From current slide. There we go. Oh, goodness. All right. Just a quick note, as I pointed out earlier, we have some COVID-19 programs and resources that are available right there at the top of the website. So I want you to be aware of those. We know that this is a very difficult time, and we want to make sure that you have those available to you. And so I wanted to allow some time for questions, maybe some discussion. I saw a couple in the chat box, Jessica, and I know we have Amy from National PTA also on today. So Amy, if you feel like you want to jump in, feel free, please. Kimberly noted that they face shortages of mental health professionals that serve adolescents in their community, and and where to go right? And how to find those telehealth or psychiatry services. Do you have any suggestions for how they might identify resources in their community?
Yeah, I mean, for just from an insurance standpoint, I do know that Anthem, and I'm sure and others, have really embraced telehealth and telepsychiatry. And I mean, virtually all services, including services of higher levels of care, are now done in a virtual way. And, you know, one place to ask about that is, you know, is your insurance company, and giving them a call. Because if in the past it was difficult to get somewhere due to transportation or other sort of physical barriers, then telehealth might be an option. For those that don't have internet access, that can be challenging. There are things like text therapy and chat therapy, and even now coverage of phone services. So particularly during the period of the emergency. So exactly, someone's putting this in the chat. There's some waivers for phone services now too. So you can use the phone to get some of these services, or even use text-based types of therapies as a potential, you know, as a potential resource.
Yeah, that's terrific because not everyone has access to internet or to reliable internet, so that's a really great option. And Kimberly asks about options for uninsured or underinsured. I know that the Substance Abuse Mental Health Services Administration has you can call and they can identify a particular treatment facility or providers that you can see if you do not have insurance coverage. So any other thoughts?
I saw something in the
Yeah, I mean,
chat. Oh,
Oh,
sorry.
please.
Didn't mean to interrupt. About someone working on peer support programs due to shortage of professionals.
That's a great option, and we have our student clubs, which I think would be a nice add-on to that as well. Wonderful. So also
yeah,
check
and
out
the
that
other
community connector. We have low and no cost options in the community connector as well.
Yeah, and another just resource, depending on what state you live in, there may be some resources available through state-funded programs that could be helpful for those who don't have like a commercial insurance.
Mm-hmm. Now, Jessica, somebody posted in the chat box something about how we're all online a lot right now, right? And might that exacerbate some existing mental health issues? What do we know about that?
Yeah, that's a good question. And there has been research done around that area. And yes, it can. It can lead to things like more isolation and lack of that communication. I think it just really depends on how you use the tools that you have at your disposal. You know, the digital resources that everyone is using now, they can also help to bring about more social connection to people that you're not able to see, or that people you wouldn't maybe be able to communicate with otherwise. I think the key is, though, that everything has to come with some limits around it, right? So you don't want to overdo it with your use of any kind of digital tools, but you want to use everything you have as one tool in the tool belt. But is there literature that argues that apps and more digital technology could potentially worsen mental health? Yes, it can. But you just have to sort of be mindful of how you use the technology too.
Great. Elizabeth notes that she works for the county health department and that they're working with several stakeholders that work to train peer supports to deploy into the community, and that training would be for 2 days and for those that have a mental health background. around. And so check out the chat box if you want to reach out to Elizabeth about that. Oopsie. So I wanted to also take a moment to show you some of the references. We are all about citing our sources. Any other questions, comments, thoughts? Okay, well, while you think about that, let me let you know about continuing education. We have one continuing education hour available for this webinar through NCHEC, which is the CHES or MCHES certification. We can also provide you with a participation certificate so that you can submit it to another credentialing body. ASHA members will receive free continuing education credits. So if you'd like to join, you can get those for free or you can get those for a fee. And you can get your CEs by completing the webinar evaluation. And Caitlin's going to put that in the chat box. She'll also email it to you afterward. But if you want to just go ahead and click in the chat box and take care of that right now, you absolutely can do that. We are going to also make the slides and this recording available to you after the fact. We want to let you know about a couple of upcoming events that ASHA has planned. On July 13th, we're going to be doing a full day free virtual workshop related to COVID-19 and preparing for our new learning environment. So we're going to talk about a variety of things, including health equity, how we keep students safe, how we keep staff and students, or how we help them cope, and how we ensure that students are going to be academically successful. So please spread the word about that. It's going to be a great day. On July 16th, we're going to be talking about the WISC model from framework to practice to application. So I hope you'll join us for one of those wonderful events. I think, you know, a lot of us have a lot of anxieties about what the fall will look like for schools, and hopefully we can have some great conversations about that. Jessica, I want to thank you so much for your time and expertise. This has been wonderful, and I want to thank all of our partners on this project. It's been a terrific, terrific partnership, and I think we're really doing wonderful work that's really meaningful, particularly right now. So just as a reminder, if you want to reach out to ASHA, that's our contact information. And any last words?
Thank you, everyone, and it was my pleasure.
Thank you, Jessica. Everyone have a wonderful day, and thank you so much for joining us.